Hello, my name is Gina Ragland. Thank you for joining us today for our Facebook Live AARP Prepare to Care event. No matter where you are in the journey of family caregiving, having a good framework to help guide both you and your loved one will make the process easier. Today's session will assist you in developing a framework to help you make plans to care for friends, family members, or loved ones, tips and advice for forming your plan. You will also learn about resources available to you and your loved one. During the presentation, if you have questions, please type them into the comment section and we will address them as we go along. There will also be time at the end of the presentation to do questions as well. Our guest partner presenter today is Carla Fries with Care Partners of Nebraska. Carla received her master and bachelor's degree from the University of Nebraska-Lincoln and nursing assistant at Southeast Community College. In 2019, she became a certified dementia practitioner. She is certified as a hospice volunteer through Horizon Hospice and Tabitha, and she has spent her entire professional career supporting our aging population. Carla assists families with care coordination and healthcare options. In the community, she coordinates partnerships within the healthcare continuum to support aging adults. Carla is married to Derek and they have 3 children, 2 of which they are now also balancing homeschooling. 3rd grader and kindergartner. Rosalind is 9, Ruby is 6, and her son Kate is 2. AARP has been fortunate to have Carla's talents volunteering her time and providing presentations on Life Reimagined and Prepare to Care for the last 3 years. It is now my honor and great pleasure to introduce to you Carla Fries. Carla?
Thank you so much, Gina. Welcome everyone. Excited to present to you virtually Prepare to Care. I encourage you, we've got a link here. I encourage you to request a guide. Normally when we would do this in person, we would be handing out these guides to you for your purposes to follow along. But in this case, we are accommodating with technology. So you can request a free copy mailed to you. You can call, you can also download it. So we're going to do our best to go through it. And I encourage you here as next steps to request the guide. You never know when you could find yourself in charge of a loved one's care. From a catastrophic injury or a healthcare event, there are sudden changes and those circumstances change your life too. So like Gina said, together with families, we create partnerships, we help navigate healthcare options and provide resources. My contact information is here and I'll also present it at the end of the day here, but my number is 780-1211. There's also an email if you have questions that you think of that you would like to send via email, please feel free to do that as well. So today we're going to share practical information to help you care for your loved one while also best caring for yourself. So we're going to talk about 5 steps, which are starting the conversation, forming your team, making a plan, and important to share that plan, finding support, and caring for yourself. I've heard from so many families lately who are suddenly in charge of kids homeschooling or different new demands on time, that their routines and rhythms just no longer fit. And there's emails, there's new worksheets, there's projects, there's Zoom calls, plus you're quarantined at home with so much stress. So as we've seen shifts for families, you can see here in this pie graph that this is more relative and imperative now than ever before. You can identify here, hopefully, when you look at this, where you are. And ask yourself, are there new demands on your time? Has your circumstances with the loved ones that you're caring for or for yourself required you to maybe pivot? When we look at the last 2 pie charts, we really see families in distress. We see caregiver burnout or fatigue, and that is when we have no personal time and you see that caregiving portion of your time just taking over, especially when you get to that 24 hours a day. That's really when people hit their tipping points and they lose patience and our quality of life isn't what we want it to be. And so part of this prepare to care is to be proactive, to keep you in the upper pie charts where you've got a balance. It's not always going to be an equal balance, let's be honest, but you at least have a balance where you have family time, you've got caregiving as part of that, your work is part of it, but you also have personal time. And so that's really important. When we think about being a caregiver, it's a variety of different things. And normally when we're in a presentation, I would have really neat AARP stress balls. And I hand everybody their stress ball. And as we talk about a caregiving activity, they throw the ball at me. And so these are just a few things, but if you can just kind of visualize me trying to catch all of these balls. But, you know, when we think about caregiving activities, you know, are you helping somebody with household tasks? Are you going over helping with cleaning or laundry or maybe yard work? There was just a lot of yard work that recently people were out doing. Are you helping somebody with medications? That's huge. A third of hospital readmissions could be prevented if we were taking the right medications at the right time. Are you helping cook or provide meals? Maybe you're helping with transportation, or you're accompanying somebody on visits, especially when we need to get doctor summaries or visit summaries. Making shopping trips right now is a very difficult time, especially for seniors to have the food, the medicine, all of the errands, we're really needing somebody else to step in during this pandemic to help run those. Are you providing personal care such as bathing, dressing, personal hygiene, helping a loved one make sure their finances are in order or bills, emotional support? You know, it's really important. We can have a lot of technology in homes, which is great, and there are solutions, but there's nothing that can replace human connection. So, you know, as we mention all of these things, there comes a point where I have so many balls in my hands that guess what happens? Some of them start to drop, right? And that's exactly what we have to do, is we have to decide what are the balls that I can let drop, and what are, or pass to somebody, and what are the things that I want to hang on to? What are the most important tasks that I need to hang on to? So that's part of evaluating and being prepared to care. So as we start the conversation, which is the most important part here, look for an opening. Right now, you certainly know somebody that maybe has been sick, or there's been somebody that was unprepared, where you have a story and you could say, gosh, you know, this happened to so-and-so, and there wasn't really a plan in place, and that was really stressful for their family, or for their adult daughter, or their power of attorney, whoever it is that's helping them. You know, if that were to happen to you, what would you like? You know, so you can use that as an opening when you have somebody that you know. Or I'm starting to think about my own estate planning. You know, do you have any advice for me? You know, could you share that? Or I just ran across an article right now. There's some just great webinars, great articles out there. You know, I was just reading whatever it is to break the ice, and it got me thinking about, you know, what if that happened to you, mom or dad or son or daughter, however this conversation looks. But how could we anticipate and get that conversation started? We need to identify the wishes or the goals. And then also really important is we need to be on the same page and see the present reality. We need to size up the situation. And sometimes that requires a third party. When there's been a health change and there's a stroke, or there's cognitive impairment, or there's a traumatic brain injury, you know, and we've got aphasia or whatever it is, you know, it's really hard sometimes to see our loved one's new reality. And when we hear a prognosis, to say, what are the next steps? And this is my new John, however that looks. And this is the reality. And so for us all to be on the same page, sometimes, like I said, those are really tough conversations to have. And sometimes they do involve third party, and there's a lot of education involved. So when you think about goals, really to identify, especially if we're recovering, what do you want that recovery to look like? Now more than ever, it's really important to have a plan in place. I was just having a conversation with a rehab partner and, talking about just regulations right now. And when we're going through all of the precautionary measures that we have to take, there are people right now that are in rehab facilities that they cannot leave their room. So, when you think about, if you're recovering from something, where do you want to recover? What does that look like for you? What is the best plan? And to know that you don't have to do this alone. Are you going to stay home? Or are you going to transition your family? Maybe you have a goal, and your goal is that you're going to move in with your children. They need to be on the same page. They need to agree to that. Or right size, maybe you have a big house and you just want to get to 1-story living, or a community, and you're starting to do your research and know, if there's a waiting list, or if there's a deposit you need to put down. If there's home safety where you need to improve or make some modifications. AARP has an additional resource with a home fit guide that has fantastic ideas to make your home safer and lifelong spaces, some tips and tricks on that. Staying active, how important that is. Positive relationships, and again, really important, when you create a plan and you're advocating for your plan, it keeps you in control. So part of those conversations need to incorporate these aspects. Money can be a particularly sensitive subject to talk about, but it's often the heart of many decisions your loved one makes. So they have to consider, that investment, whatever it's going to be. If it's an investment in housing, if it's an investment in home care, other expenses as far as getting help with groceries, medications, transportation. So you need to be on the same page as far as knowing an idea about bank accounts, investments, insurance coverage. Is there long-term care insurance? We do many long-term care reviews. Many of our clients had no idea that their long-term care insurance would cover their home care. And so we've gone into policies to see, what are the options, and making sure that children or power of attorneys, they know about them and they know where to find them and who the contact people are. And remember that unless somebody's a power of attorney or they're actually on an account, they can't step in and transfer assets should you need them to. So that prep work really has to be done before someone's incapacitated. If you need a trusted advisor or a mediator, now's the time to reach out to establish who that person is. Often families really appreciate knowing really clear expectations of what's going to happen and to be able to take emotions out of it. Helps keep harmony in families. I have families call and ask me, Carla, when's a good time to have this conversation? My advice, honestly, is right now. You don't need to wait for an emergency or any of these red flags to have these conversations. Prepare to Care is a great conversation. It's a great workbook. Again, download it, fill it out, and go through it with your team right now, especially in the midst of COVID-19. This pandemic has been a catalyst for all of us to get our planning in place. But in addition to right now, if you needed a red flag to look for, and this is a question I get often, so here are a few. When there's a healthcare event, when you realize somebody's missed doctor's appointments, and we realize right now some doctor's appointments are on hold, but know that a lot of them you can do telehealth or a televisit. When you see somebody is losing track or forgetting medications, they're not eating, signs of depression. They're reluctant to let you see the house, not wanting you to come over. And again, our situation is a little different right now, but in general, when things are unkept, their personal hygiene is suffering. And often we see that somebody's had a fall and they're afraid to fall. They might be afraid to shower, when they might want somebody standing by. Unpaid bills, missing or decreasing in social engagements, and if they've ever had a fall. So those would be red flags to look out for. And when something like that happens, it really needs to be a catalyst again for you to start this conversation. Forming your team. Do you have a 31? I ask that question, and I usually ask the audience with bribery, and maybe it'll be a candy bar or something like this. I'm sorry I can't throw you a candy bar right now, but what do you think a 31 is? The answer is, for the most part, there's 31 days in a month, and it's somebody who's going to do some sort of check-in every day. So when you look at your team, think about location. Who lives nearby? Proximity definitely has its advantages, such as stopping over to see loved ones. Oh, it's right on my way. It's not far out of my way. Or maybe you have a neighbor. We have home care clients that have really great neighborhood watch setups. And so they might be in agreement to look for certain lights on or off, or if newspapers have been picked up. Or I have one client that raises a flag every day. And that neighbor knows that if his flag has not been up, something's not right. So family and friends living at a distance can also help with a variety of different tasks. So there may be something they can do remotely, such as maybe helping get auto bill pay set up. Or maybe you have a grandchild or a niece or nephew that's really great with technology. Maybe they could help you with social media. Take a look at privacy settings, make sure those are all exactly how you'd like them to be. Checking email, FaceTiming, etc. When you think about time, know that sometimes asking for help might be shifting priorities. And so if your daughter or whoever this is taking enough time to accompany you to a doctor's appointment, she might not also be able to have several hours to do laundry or meal prep for the week. So maybe somebody else steps in and we just shift those priorities around. And then we think about capacity, know that it's really important for caregivers, if they don't have the education or the calling to step in to be a caregiver, to ask the question, is that a skill that they're willing to learn about? Is that a role that they want to have, a responsibility that they are agreeing to? The future of healthcare is coordinated care. Quality is now measured by improved health outcomes, and interdisciplinary teams provide service integration and better care management. You've got to have your healthcare partners have to be part of your team. Provider partnerships working together are strengthening preventative care. They're reducing the risk of hospitalization and ER visits, which is better for everybody. They're lowering the risk of falls and assisting patients to help manage more chronic diseases and possibly managing those at home. So there's a lot of communication that happens with both family teams, informal caregivers, formal caregivers, and healthcare. And communication is key to keep everybody on the same page to maintain your strength, your balance, your endurance, and to provide that preventative care. This is often a question that I get asked almost probably every presentation. What's the difference between home health and home care? Because sometimes the lines are very blurred when you read about agencies. Home health requires doctor's orders, medical, task-oriented, often short-term. The payer source is typically Medicare. Home care, and that is the industry that I am in, is private duty, it's supportive, non-medical, relationship-oriented, or I like to say person-centered care, often extended hours, but it can be short or long-term. The payer sources can be long-term care insurance and private pay. So you make a plan, and important, share the plan. You need to hold a team meeting. And right now, those family meetings can be done in a variety of different ways, but they will help you get things organized, ensure all your team members are on the same page when it comes to making and keeping the plan. So how do you meet with your caregiving team right now? Sometimes it can be face-to-face. We realize right now that might be a conference call, a Zoom, it might be a series of emails. It might be filling out your workbook, again, Prepare to Care workbook, and sharing it. You're looking at, you're assessing the goals, the needs, you're making sure they understand the why behind the ask, and you're confirming agreement for responsibilities. So if you write my name down, it's okay to, I encourage you to write in pencil. When I do this presentation, I'll pass out pencils because it gives us permission, and we know that things can change, and that's okay. But having some sort of plan in place, even if it's in pencil and it changes, is better than no plan at all. So when you go through these items, you have to think, when I can no longer do whatever this activity is, for example, drive, my point person is who? Who's going to help me with that task? Or if there's not somebody that you can think of to write down their name, will you hire help? Where will you hire help from? Will you use home care? Will you use a community resource? Or who will you call? So know who your resources are. And again, at the end of the presentation, Gina's going to go over a lot of AARP information as far as resources. Some of those items that you're going to fill out is, again, home maintenance. If you need something, who's going to be doing it? Home fit modifications, whether that's making bathrooms safer, grab bars, entering and exiting the house, etc. Personal grooming, bathing, dressing. There are some things on here that some family members are willing to do, but there are some where they're not as comfortable doing. Bathing is one of them. We have several clients where there might be a son that just says, I'm not comfortable helping my mom with the bathing or the dressing, and so the caregiver might come in and do that and supplement help in that way, and that allows that son to be in the role of son and not a caregiver in that way or for that task, but he's happy to help with home maintenance or other things. So it's really just finding the right fit for each person. Medication reminders. Again, the question is, if I'm not able to do this, the what if happened, who is going to help me with it? And it's forcing yourself to go through and put somebody's name on all of these lines. And after you do it, really reflecting, because it has happened in multiple of my presentations, and I'll stop and say, what did that feel like? And somebody will say, gosh, I just realized I'm putting a lot of burden or stress or responsibility on my son or my daughter. And, you can't write down Carla on every single line because I don't have the capacity to do all of those tasks. Again, it has to be a team. We have a shrinking family caregiver pool. AARP estimates that the ratio of potential family caregivers to those over 80 will decrease from 7 to 1 today to 4 to 1 by 2030, and then less than 3 to 1 by 2050. Also, America's mobile society means more and more family members are living farther and farther away from each other. On average, adults 60 and over with more than one adult children live more than 280 miles from their nearest child. So all of these factors contribute to widening the gap. There's also an increased number of that term that's called elder orphans. So people that don't have children need to develop who that team's going to be. Realize the impact on informal family caregivers. Being a caregiver is emotionally stressful. there's great emotions, there's stress, there's anxiety, there's guilt, but there's also satisfaction, accomplishment, love, and tenderness. It's, we need to find the balance. It can be physically demanding, especially if you're helping with transfers. It can be financially straining. There's competing demands we talked about. Family dynamics can really strain a marriage if you don't have enough support in place. And then again, that work-family balance, where right now we're called in a variety of different ways. We used to have the term sandwich generation, referring to many of us could be caring for our parents, and then we also have children. And now there's a new term, and it's a club sandwich, because there's another generation involved. We're living longer. So not only do we have parents, and we maybe are working, and we have children, but our children have children, we have grandchildren. So there's 4 generations putting more demands on our time. Spousal caregiver mortality. This is really important because our spouses who are assuming informal caregiver roles are at risk. Elderly spousal caregivers who experience caregiving related stress have a 63% higher mortality rate than non-caregivers. In 2006, hospitalization of elderly spouse was found to be associated with an increased risk of caregiver death. Approximately 30% of informal family caregivers die before the person they're caring for. So if you're watching this and you're thinking, well, it's not me that needs the plan, I'm healthy, I'm in good shape, know that this is important for you too. Your health is so very important. If something happens to you, now we've got 2 people where there's a lot of changes involved, and if there's no plan in place, that's a highly stressful situation. So we need both spouses to have a plan. When you think about plan, and I won't go into too much depth here into the senior living spectrum, but and many families right now have kind of put moves on hold during this time, and there's a lot of facilities that aren't allowing tours right now. They have virtual tours, but there's a lot of no visitation rules in place for infection control. So we've had families calling us requesting support to bring in caregivers to bridge this gap to keep their loved one safe, happy, healthy at home until they're moved or until restrictions on facilities change. But you can see here with the senior living spectrum, this bubble graph shows different types of senior care, how they overlap, and then the relationship between the level of supervision and how that relates to the cost. The more supervision, the higher the cost. When you get into actual numbers, this is Lincoln, Nebraska, and this is from genworth.com. So if you're viewing this presentation, you can go into genworth.com and type in your city and state and get your actual numbers from last year. But as you prepare to care and as you're plugging in what investments look like, you can see here what the home care investment looks like. And I've done 20 hours a week. And then you can compare it to an assisted living or skilled nursing in a semi-private, a shared room versus a private room. So you can see here the cost of healthcare, and know that these are all private pay. So the only time your Medicare is going to kick in for that rehab is typically when you have a 3 midnight stay, and that's short term. So your next steps, you need to be financially preparing for. Finding support. Like I said, it's important for you to have that team and make sure that if you need to hire help, you're seeing, gosh, I'm burnt out, I need some help. You might just start off with a little bit. We have one family, we provided respite care for her while she was a 24/7 caregiver for her husband. And during that time, she was able to get out to see her grandchildren, to go have lunch with her friends, to get her groceries, to get her hair done. And that respite time for her was so important. And those 3 hours went a long ways for that family. So if you do need to hire help, again, it's something you can do on a small scale. and make sure that you're securing their safety. Do a home safety evaluation. Again, AARP's Home Fit Guide has really nice checklists available, and know that if there's something that you need to modify, you don't have to wait for a fall to happen. That happens so many times with, people that we're serving, or they say, we need your help, so-and-so fell, and before they come home, we're going to make these changes now in the house or in the bathroom, or we're going to remove the throw rugs, add more lighting, things like that. Don't wait for a fall. Do that now. And again, to plan ahead. Caring for yourself. Whenever you're able to, I encourage you to pair tasks. So when we can do dual caregiving and we're caring for ourselves along with somebody else, that's better for everybody involved. This includes when you make appointments. Can you both get into the dentist? Can you make an appointment for both of you? When you're taking meds, however many meds you take or your vitamins, take yours at the same time. Brushing your teeth, do it at the same time as your loved one or your person you're taking care of. Physical therapy, there's a lot of home exercises where, you get discharged from therapy and they leave you and they say, all right, we'd like you to do this series of exercises every day. Now, how many people are going to continue those exercises or those stretches unless somebody else keeps them accountable? That's where you come in. Do them together. And why not do the stretches? Why not do the exercises together? And if you can't, hire a caregiver, they will do the home exercise. We do a lot of restorative care. But making sure that whenever you can, have that mindset to not only do, not to do something for someone, but whenever you can, to do it with someone. And make sure you're caring for yourself. Don't overlook the impact that caregiving has on you. Pay attention to your health and your well-being. The best way to ensure you have the energy to care for a loved one is to take care of yourself. We've all heard of the oxygen mask on the airplane, to put your oxygen mask on and then the person next to you. But unless we're caring for ourselves, it's very difficult for us to continue caring for somebody else. We can't run on empty. And if your tank is on empty, you need to find ways to refuel. The term, I'm just a phone call away, call a friend, get some sleep. You need to have an overnight, somebody to come over and spend overnight with the loved one, then do it. You need sleep. Take a walk or stretch. There's a lot of online exercises or physical fitness apps right now that are free. Making sure you're eating a healthy diet. It's so easy for us to eat comfort foods, but just be really careful as much as you can to have a healthy diet, something that's going to make you feel good. Organize and simplify your day as much as you can. Organize the house as much as you can. I like the term bless and release. So when you're not using something, to bless it and release it to somebody else that will find joy. Join support groups. Prioritize quality time and the activities that are most meaningful. Again, there's going to be some balls that you have to drop and let somebody else fill in, and prioritize what are the most important things that I'm called to do that need me specifically. Find a hobby, start a gratitude journal. Love that. And recognize highlights. There's a lot of days that are very difficult when we're caregivers. But when we do have those feel-good moments that just fill your bucket back up, recognize them and tell yourself, like, I'm doing a great job. And if you're called to, sing and pray together. I'm part of a hospice choir, and that is something that just makes me so happy to be able to sing for people. Even right now, my girls and I, we can call my grandma and sing church hymns. And we pick ones that she knows, and we're FaceTiming with her, and she's singing right along with us. And that's really special. As a caregiver, we know you're changed forever, but this can be in a good way. And when you're prepared to care, That kindness will not be forgotten, and together we can celebrate the joys of caregiving. So we talked about how important it is to start conversations, put a team in place, share your plan, find support, and care for yourself. I'm going to turn over the mic to Gina, who's going to talk a little bit more about resources. Gina, you appear to be on mute.
I apologize. I was on mute, double muting. Thank you again for joining us with this webinar on the Prepare to Care. We're going to go through the resource slides with some different options for you to look at. First one, we want to remind everyone, if you do not already have one of the Prepare to Care guides, you can